Hello, I'm Andrea Stallings. This is my third video assessment of the musculoskeletal and the neurological system. This is my patient Bethany, who is, how old are you, Bethany?
18.
Do you consent to this exam?
Yep.
Okay. And while I'm doing this exam, if you feel any pain or have anything hurt, just let me know, okay?
Okay.
All right, so if you want to scan the room one time for me, and then I'll have you scan the room again halfway through the video, just to show that I have no notes out. The floor, the dog. Okay. I do have my rubric, which I have with me just for something to go by. And there's no notes or anything written on my rubric. It's just the rubric. I'm going to lay that on the table and I will start with my exam. Okay, Bethany, the first thing I'm going to do is inspect and palpate. That's what I'm going to do for this exam, just inspection and palpation of the musculoskeletal joints. So I'll check for alignment, contour, symmetry of the bones and muscles of her. I'm going to start with her cervical neck, her range of motion of her cervical neck. Can you see me good what I'm doing? Okay. What I'm going to do is check for her strength. So I'm going to have her push her cheek towards my hand. Okay, good. Now towards this hand. Push your cheek. Okay. Good, good. Okay, now I'm going to push your forehead against my hand and I want you to push forward just to check your strength. Good. Then I'm going to put my hand back here and have you push your head backwards against. Yes. Okay, good. And I'm going to check her her joint here, her sternocleidomastoid joint. It's just right at her tragus. I'm going to have her open her mouth as wide as you can and close it. Any pain? Okay, those things were both symmetrical. Her skin looks good. So your shoulders, I'm going to have you flex your shoulders forward. Okay, good. And hyperextend your shoulders backwards. Good. So then I'm going to have you do your shoulder, check the range of motion in your shoulders by doing your arm. You can stand up if you'd like.
Just like
Good.
other arm.
And the other one. Good. Okay, you can sit back down. Okay, so then I'm going to take your bicep, I'm going to try to, give me some strength. I'm going to try to pull it away and I want you to try to flex your bicep. Good. Okay. Now, I'm going to try to, you hold them up like this, and I'm going to try to push them down, and you, good. And then you try to go down and let me try to go up. Good. Okay. Your wrist and your hands. So what I'm checking for, I'm just checking your wrist, and I'm bending your hand up and down at the wrist. I'm going to have you hold your arm out straight. I'm going to have you flex your hand down, extend your hand up. Do that same thing with the other one. Any pain? Okay, so then I want you to use your right one again. I want you to go abduction into the body with your thumb, and then abduction away from the body. Kind of straight like that. Okay, now do the other one. Inward, adduction, and then away, abduction. Good. So I'm just going to palpate your joints of your fingers, your phalanges. I'm going to palpate your wrist. I'm going to turn it over. Any pain while I'm doing that? Okay. Do the same thing for this one. Doing the radial and the ulnar deviation. So I'm going to have you go, just like we did, go in and then out. Any pain with that? Okay. Okay, then I want you to take my 2 fingers with these hands, and now I want you to grip. I'm going to check your grips. So squeeze. Good. Okay, good. I'm just changing the, going over to the next page of the rubric. Okay? I want you to, okay, so now we're going to go and lay down. If you want to just lay down, we'll go in here. You'll just follow me. We'll go in here, and I'll just have you lay on your back. Okay, so what I want you to do, I want you to raise your leg above your body with your knee extended. Good. Any pain? Can you raise it up a little higher? Okay, then I want you to bring your knee to your chest as good as you can. Okay, good. Now do the other leg like that. Good. Any pain while you're doing that?
Nope.
Okay, so then I want you to raise your leg up and swing it out laterally and back to normal and in medially. And then do the same thing to the other one. Out laterally, in medially. Any pain while you're doing that? Okay. Okay, so then I'm gonna have you raise your knee up, and I want you to bend your knee out laterally this way. Any pain there? And in this way. Okay, the same thing with the other one. Out this way and in this way, laterally, medially. Okay. Okay, let's go back to the chair. You need help getting up? Okay. Okay, so what I want you to do is just alternate your leg crossing. Just cross one leg over the other. Okay, and then the other one. Okay, and then what I want you to do is touch your heel to the other shin here. Okay, good. All right, so your ankles and feet. What I want you to do is point your foot up towards the ceiling and down up towards the ceiling, down towards the floor. The other one up towards the ceiling, down towards the floor. Good, good. I'm having a hard time doing this without looking at my notes. Can you cut that part out? Okay. So I want you to rotate your ankles in a circle. Any pain while you're doing that? Okay, your skin looks good. I'm gonna do this one. Okay, I want you to try to push your foot up a lot. Any pain while you're doing that? Okay, and I want you to push down like a gas pedal. Okay, the same with this one. Down like a gas pedal. I'm just palpating her toes. Her color of her feet are the same as the rest of her body. Warm. No hammer toes or corns or bunions. Anything like that. Okay. Okay, I'll have you stand up. Just turn this way, if you will. Okay, and then what I want you to do is bend as far back as possible. Extend your back just as far as you can. Any pain while you're doing that? Okay, now stand back straight. So I want you to back up just a tiny bit here. I want you to bend down and try to touch your toes. And I'm just gonna look at your skin here, look at your spine. Feel each spine out and make sure everything's okay. Slowly rise back to the standing position. Okay, good. So what I'm going to have you do now, you okay? What I'm going to have you do now is I just want you to walk across the room heel to toe and then walk back heel to toe. I'm just going to assess your heel to toe gait. Okay, now Now come on back. Can you look straight ahead? Okay, good. Okay, and then what I want you to do is have your feet slightly apart. I want you to stand straight and just close your eyes. This is the Romberg's test. Just checking your, you can open your eyes. And I'm looking for swaying. Now close your eyes. Okay, good. That was the Romberg sign. Okay, now you can sit back down. Well, actually, while you're doing this, I want you to stand here. Put both of your arms out, and what I want you to do is keep your eyes open, and I want you to touch this finger to your nose, and then come with your left, and then, okay, to the tip of your nose. Now keep doing it. Okay, now close your eyes and do it. Good. Okay, good job, good job. Okay, and then, okay, so I want you to go ahead and sit down. What I'm going to do is have you close your eyes and hold out your hand, and I'm going to place an object in your hand, and I'd like you to tell me what it is.
Paperclip.
Good.
Can I touch it?
Yeah.
Quarter.
Mm-hmm.
Dime? Penny?
Penny. Mm-hmm. Good. Good. And that is called stereogenesis. The ability of you to sense what's in your hand is called stereogenesis. And now I'm going to perform a test called graphesthesia. I want you to close your eyes. I'm going to just write a number on the inside of your hand. I want you to tell me what the number is.
8.
Mm-hmm.
4.
Mm-hmm.
7.
Mm-hmm.
3.
Good job. Okay, so now what I'm going to do is keep your eyes closed, and I want you to tell me when you feel me touching you, okay? With the light touch. You ready?
Mm-hmm. I felt it. Wait.
Just say yes or now.
Now. Now. Now. Now. Now. Now. Now. Now. Now. Now. Now. Now.
Okay, good. So now I want you to tell me if you feel something sharp or dull. Okay?
Okay. Wait, close my eyes.
Close your eyes, yes, I'm sorry.
Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull.
Good, okay. I would do vibration sense when I have a tuning fork, and I put the tuning fork on have a tuning fork activated on different parts of her body and tell me when the vibration stops, but I do not have a tuning fork. So I'm going to check your biceps reflex. So I'm going to take my reflex hammer, and I'm going to okay. Now this one. Good. Okay, your brachio, I don't know how to pronounce that, your brachioradialis reflex. I'm just gonna hold that down right there and just, good. This one, good, good. And then you just sit back as far as you can so your feet are, like, yeah. And then I'm just gonna reach down here to get our patellar reflex. Got that one? Okay, good, good. And then the ankle jerk reflex. Okay, and that is the end of my assessment. Thank you.